Ready?
All right. Well, good morning, everybody. Thanks for joining us for today's webinar on the different types of medical IDs that there are out there. We have Brent Fisher with us today, and he's going to go over those things for us. And
Good morning, everybody. I'd like to take a moment to say some thank yous. First of all, I'd like to thank Misha for driving the presentation for me. She has a little bit more technology expertise in this than I do, and it's deeply appreciated. Alexandra for setting up the webinars and everything, getting this all coordinated for us. I'd like to also thank the Blue Ash Fire Department, especially Brian here and Chief Theaters for letting me use the room and providing the facilities to pull this off. And I'd like to welcome all of you to the first medical ID bracelet training. I don't want to also forget Chief Westendorf I met with last year, who helped spearhead getting this all started and laying the foundation for it and introducing me to people like Misha and Alexandra. And I'd also like to say thanks to her and everybody, the current president, Rick Anderson, Vice Presidents Mark Kidd and Colin Altman for helping out and getting this approved as well. So for all you guys out there on the front line, I'd like to say thank you. I know exactly what you're going through. Some of the background and the reasoning for this is I did grow up in the funeral home with an ambulance service. So I know what it's like to see my dad leave in the middle of the night in icy conditions, the brutal heat, having to lift people back when the only thing that existed was an ambulance, a beacon, a cot, an oxygen mask, a Band-Aid, and an accelerator. So much has transpired in the last 44 years in terms of technology and all of the things you guys have to work with today to make your jobs easier, but it's never easy, and I know that. So again, thank you. But what we need to do, and the reason for this is to bring some of the tools that are actually available, but maybe a lot of you aren't aware of, in today's technology, and that is the medical ID bracelets. With that said, let me go ahead and get started with the first one. Basically, what they are today versus in the past. Let's go ahead and hit the next slide here, and we'll kind of lay a foundation for the presentation. The first thing that every medical ID bracelet has is the star of life. That indicates that the person wearing it has medical information that they would like you to be aware of and utilize. The next slide is going to show you exactly what each one of those parts of the star mean. We can go ahead and go to the next slide. The detection, reporting, response, on-scene care, care in transit, and the transfer to definitive care. So each one of these are a critical part, but each one of those can actually make your job easier and more knowledgeable, because one thing that I do know, absolute, is you guys are out there, ladies and gentlemen, because you care. It takes a special person to want to go out to scenes where people are injured, the various conditions they're in, the weather conditions, you know, having to get people out of basements, tight spaces, roofs. It's all physical, but you're doing it because you want to do it, and it means something to you, and that means something to me as well. So again, thank you for that. Let's go to the next slide. As you can see, we no longer live in a typewriter world. We all have smartphones that are smarter than Apollo 11 was. If you look at the old bracelets, they were basically one word engraved. It gave you an idea of what was going on, but it didn't really give you any details. So yes, they are a benefit, but as time progressed, so did medical ID bracelets. Let's go ahead and hit the next slide here. In today's medical IDs, there are various types, USB, there's the Q code readers, and then there's the engraved. The most prevalent are the USB and the QR code. Access can be obtained on the USBs by plugging them in. I know the dangers of that. And there's also the QR code, which is honestly the one I prefer because it has no viruses, you know, anything like that, malware or anything on it. Most of your QR code readers and the USB readers And some of the newer engraved readers also have phone numbers, a website, pass PIN numbers, and codes you can put in to your computer to pull up the information, or even call and get an emergency response team similar to 911 at the call centers for the providers of the bracelets, so they can give you the information regarding the patient as well. So let's go ahead and do the next slide here. Again, the advantages of the QR codes is the lack of viruses, malware, spyware, and stuff like that. But on most of your phones today, the newer Androids, iOS 11 and newer, QR codes, barcode readers are actually built into the cameras of today's modern cell phones. Let's go ahead and hit the next slide here, please. This is basically one of the more popular QR code, barcode readers out there. One is for the Android and one is for the Apple phones. If your phones don't have that capability, I personally use the Neo reader. It's extremely efficient, pulls up information within seconds, very little delay to it. All right, let's go ahead and hit the next slide here, please. This goes back to what I was kind of talking about in the very beginning. The world that you work in today is surrounded by technology. An empty ambulance can cost up to $250,000. And then you got to stock it. Air chairs, hydraulic cots. My dad wished he had those when he was in business. Temperature controlled drug storage, immobilizers, EKG cabinets. All of this is a horrendous amount of money. By the time you add that in, you're looking at $500,000 approximately in technology that you utilize every day. The medical ID bracelets are designed to help you be more knowledgeable, even more caring about who you're helping, and to help also make it easier for you to make decisions. Once those decisions are made and known, again, going back to the Star of Life, once you transfer that patient over to definitive care in an ER or doctor's office or wherever you end up taking them, then that information can be relayed to them as well. All right, let's go ahead and take the next slide here. We've embraced all kinds of technology in today's EMS fire world. Why not embrace and bring up the medical ID technology to match all of the things that you have today? Again, I know you're in the business because you care. I don't know how much anybody could appreciate you more than me, but again, I tell you all, thanks for doing it. You want the best for the people you care for. Again, that's why I know you're there. Everything around you is new except for the use of the medical ID bracelets. So not only can you provide better, more informed care, again, it helps you make more appropriate informed decisions, again, transferring to definitive care, but also it gives you information on how to alert their families, emergency medical contacts, and other information as well. We'll deal with that in a little bit more detail in a couple of slides here ahead. If we could go ahead and go to the next slide, thank you. Why do people wear medical ID bracelets? Your patients have the right to manage their health care, and they want you to know how to do it, or they wouldn't have a medical ID bracelet. It means that much to them. They want you to know their conditions, you know, who to notify, where to take them, the doctors that they deal with, and they're basically asking you openly to look for that Star of Life. And on most of your medical bracelets, the Star of Life's on one side, the contact information and the barcodes and everything are on the flip side. All right, but more importantly, for you guys, this is their implied consent. They're openly aware of this so people can find it and utilize that information. All right, let's go ahead and go on to the next slide, please. Again, how much did these things tell you? One word, the old typewriter world, all right? And there's a lot of different things that can appear on a medical ID bracelet, but it doesn't give you the details. All right, let's hit the next slide and we'll see what the next generation looked like. Again, this is the other one with some of the information engraved on it. It's a lot better, but could there be more? Absolutely. Let's go ahead and hit the next slide. This is some examples of the USB type, okay? They come in different formats, but the basic foundation of this is it has to still plug into something. And I understand the, the concerns about that, but it is an effective means of communication of the wearer's identification and medical conditions and things like that. But the forms of it, because it requires to be plugged into something, is more limited than the other type is, which is on the next slide. If we could go to that one, please. On the QR code type, there's a lot more flexibility. And I understand that means a lot more awareness, but it is, again, the basic foundation is the Star of Life on the top side. In the upper left-hand corner is like a sleeve for a smartwatch. You've got the medical ID cards, wallet cards, and then you've got the wristbands. As you can see, information on the back, Star of Life on the front. There's more to it with these possibilities and the flexibility of this. If we could go on to the next slide, I'll show you a few more options that the patients have to pick to wear for you. A different type of band, again, the watch sleeve. They can even put the one-word little things on it for immediate alert for more detailed information through the QR code on the back. But you see bracelets, necklaces are available. Again, front and back information on those. And then the little bracelet with the cube on it. So these allow people to be able to wear these with a little bit more comfort and fashion than the other styles are. So let's go to one more slide here, the next one. And you can see some bracelets in other forms, like in the bottom left-hand corner. I think these are one of the best things that they came up with is the stickers. And we'll dive into those a little bit later into terms of their possibilities and where they can be used. So again, there's a lot more possibilities with them, but this is what today's medical ID bracelets actually look like and what's available to the public you serve. All right, if we could go to the next slide, please. This is more of a close-up of the one, just so you have a little bit better idea of what's going on. But as you can see, as I mentioned before, you've got the website address. You can go there and put in the ID or the PIN number, or you can call the toll-free number and give the operator the ID and PIN number, and they can pull it up immediately, or you can scan the barcode, the QR code. So on all of the bracelets today, including the USBs, there's 3 ways to get the information transferred to your team on site. All right. All right, let's go ahead and go to the next slide. The stickers. There's so many different ways to use the stickers. How many kids are out on bicycles walking home from school, riding bikes to their friend's house, up and down the streets? If every kid had a sticker on his helmet and something happened, how awesome could that be for you to help them and notify their family? All right. Let's take a look at the next slide here. This is also something that you could incorporate into your own training. On the training dummies, you could put a wallet card in the pocket. You could put a bracelet on the wrist and use that for training purposes. Every training session, your training dummy could have a different condition, different symptoms. Those would also allow you to know what more medical conditions are like and how people would want to have them treated and how they expect things to be done. So the wealth of knowledge that can be obtained through this in the training class is enormous in the terms of the possibilities and even combinations of different conditions. All right, let's go ahead and go to the next slide, please. All these different scenarios are ways that the people that you're out there to respond to could help you gain information and knowledge about their information. What if each room in a assisted living or an Alzheimer unit had a door sticker on it? Retirement communities, dormitories at school. I've seen my daughter at school when the fire alarm went off. Everybody had to evacuate. What if something happened, a kid trips and falls down the steps or anything like that? This information will be readily available to them when things are not absolutely normal at the sites they're working on. Road crews, construction workers, utility roof workers and roofers, let alone tree trimming professionals. This information could be vital to them if they had an accident at work. And if you look at different things like daycares, what would happen if an evacuation had to occur? They would have information on who to contact, contact the parents to come and get them, let them know everybody's okay, not okay, or anything like that going on. When evacuations and things like this occur, generally the information is in the building, which everybody's trying to get out of, and inaccessible, right? If we could go on to the next slide, please. How many facilities do you go into that have files of contacts, conditions and information you would love to have access to after hours? My daughter has worked in daycare, Alzheimer's units, assisted living. She's seen what happens when a squad had to be called after hours. The patient was there, you were there to help them, but all of the contact information was locked up in the office and nobody had access to it. Again, the medical ID bracelets gives you that information. It's readily available and people can be there to help quicker and more efficiently. All right, let's go ahead and talk about the next slide, please. I'll let you take a moment to review what's on this list, but the list of things that can be found on the medical ID bracelet could hit any category you could imagine. Blood type, emergency contacts, physicians. Most importantly, what medications are they on and what dosages do they have? Any prior surgeries, procedures that they have had that would aid in your knowledge and how to treat them. Medical imaging, family history, even pharmacies, doctors, and associates. All right. We can go ahead and hit the next slide here. A lot of your medical ID bracelets, especially the QR code type, you can actually get enhanced levels. Sometimes there are charges for it, sometimes there's not. But this enables you to do document storage. On my daughter's medical ID bracelet, for example, my medical power of attorney that has my wife and myself as medical powers attorneys is actually listed and attached to her medical ID bracelet along with our contact information as well. So you can actually store like MRIs. If somebody's had an abdominal wall hernia surgery, let them know about that, all different kind of conditions. If somebody's injured their knee and they've already had like an ACL surgery or something like that, that would be nice to know as an example of use of what kind of documents can be attached. And I'll show you a little bit more later on that on a sample slide. All right, if we could go to the, one thing, I apologize, is one of the things I like about the medical ID bracelets the best is you can actually push a tab on the screen and it's going to call the emergency contacts automatically. And the one that Paige is using right now actually has a new feature that's not included on this slide. When her medical ID bracelet is scanned, it automatically notifies me within about 3 seconds. It pops up Google Maps. It tells me exactly where she is at the moment of the scan and directions how to get there. So that's pretty incredible in terms of what can be done today. All right, let's go ahead and go to the next slide, please. You guys could use these too. I mean, I know you know each other, but in talking with different squads throughout the greater Cincinnati region and here at Blue Ash, a lot of people know a lot about each other, but do they really know everything they need to know in the case of emergency? You know, the brother and the sisterhood of firefighters is just absolutely phenomenal. I had the honor of being at the OFCA convention last year and talking to some different members throughout the state of Ohio. Went in and met some of the retired people from the OFCA, and the camaraderie, it's just phenomenal. Seeing people respond to my daughter like if Blue Ash is busy, the mutual aid. And again, I want to thank them for this because they've also made the people that supply mutual aid aware of my daughter's conditions and everything like that. So having them know what's going on and having them care so much about people to let other people and the people they work with and their colleagues know, it was amazing. And I really appreciate that. But what if each one of you had a sticker on the fire helmet or a medical ID tag? If something would happen to you, it's going to be hard for you to see one of your colleagues hurt or fallen. And when we do that, it's just human nature that you may not remember everything that you knew in the first. So it's all right there for you, how to contact their family, what their preferences are, and where to go. So I would encourage you to embrace the technology for each other as well. All right, let's go ahead and go to the next slide. You know, on a typical scene of response, every ambulance that rolls out of your doors has 2 to 3 people on it. You also get support from your colleagues in the fire side. Usually a fire truck with 2 or 3 responders goes along with it or right behind it. Then you've got the police officers that come there to protect you from traffic and other people, standbyers and passerbys that want to sit there and gawk and look and interrupt the flow. The one thing about this is there's a lot of people there that can do this. And let me expand on this a little bit. If we could go to the next slide, please. At least one person should have time to look for and access the pertinent information on a medical ID bracelet. By no means ever does this mean the first responder should not do what they need to do first. That's not even in question, not even a request or a consideration. But I look at the EMS squads as the owners of the scene and the situation. And with today's technology that's available to you, I ask you to please delegate who's going to look for the medical ID bracelet while you're doing what you need to do. That comes first, no questions asked, and it's totally appreciated. Delegate the reading of the medical ID bracelet, and that way the pertinent information can be relayed to you while you're doing everything that you need to do to get the process started at scene. All right, so again, thank you for what you do. This is not to interfere with your job or what you have to do first when you arrive. All right, let's go ahead to the next slide, please. Who should wear a medical ID bracelet and why? This is a very short summary of all of the reasons out there, but people with medical needs and allergies, you know, there's hundreds of thousands, if not millions, of adverse drug reactions out there that happen every year. About 450,000 people a year are taken to the hospital just doing lifestyle activities while out running, biking, hiking, etc., things like that. But more importantly to me, I mean, everybody's important, but the children today, I mean, every day, 39,000 children are injured seriously enough to require medical attention. And this goes back to that sticker on the bicycle helmet. What if every kid had one of those? How much more beneficial could you be to them with that knowledge? All right. Let's go to the next slide here, please. All your newer medical ID bracelets can be updated. All you have to do is log into the website, update it. I can't tell you how many times I've updated my daughter's medical ID bracelet as things change, doctors change, medication changes, dosages change, all of that. Immunizations up to date, all of that information is going to be on there, and it can be updated very easily. So it doesn't take long to do it. It's easy to log into your username and password, and you're there. All right, let's go ahead and go to the next slide. I'm going to give you all a moment to please scan this, okay? This is going to pull up a demo of a QR code. Now, what you're going to find in here is probably more than normal. This was set up as a demonstration, so it's got a plethora of information in it that you may not see. This is this is definitely above average information, but it was set up to show you what all is possible. So I'll give you a few minutes to pull this up here. And while you're doing that, I will get mine. And I just hit the back button. I apologize. First thing you'll see at the bottom, as I mentioned before, notify emergency contacts. On a live medical ID bracelet, tap that, it calls anybody listed as an emergency contact. You got your medical conditions, personal information there. The emergency contacts are there to call if that subscriber has not utilized the services of the button at the bottom. Your allergies and medications. The physicians in the hospitals. Insurance information, which is more important for the definitive care you turn them over to. Again, this is where I picked up, as we mentioned earlier, somebody's had a knee surgery, ACL repair. Information's on there, their type, blood work, everything like that. The pharmacies, again, is not really so much for your information as it is for others. As you're going down to the bottom, this is where you can attach documents like the medical imaging, because this person had a surgery on the knee before. It actually has a very brief MRI attached of that knee. Down here is something that was very amazing to me to hear people's reaction in your field in speaking with other fire and EMS chiefs, first responders like this. This is the type of thing that could absolutely make a big change in your lives and in caring for the people that you're out there to care for. Having access to a living will document here for you, I think, is astronomical. The other thing I think is absolutely game-changing is the ability for a person to have their do not resuscitate DNR instructions there as well. So the power of information on today's medical ID bracelets is enormous. And I hope you all appreciate it, and I hope you all can utilize it in the future. Now, when it comes to stuff like this, nobody's going to expect everybody to know everything and to be able to diagnose things. There's a lot of things out there that I've found that one mimics the other, okay? Like psychogenic non-epileptic seizures looks like a real seizure. It's not, because it's non-electrical. The treatment of those two things are completely different. Like for my daughter, she does not want Ativan, Versed, and those type of things because it actually makes the condition worse and linger longer and susceptible to more episodes later than if she did not have it. There's things out there like Ehlers-Danlos syndrome. I picked that one out of the blue. Commonly referred to the rubber band man syndrome, where the connectivity tissue disorder results in low muscle mass, joints that can pop out. But the most important thing about EDS is recognizing that if you ask a person with EDS what their pain level is, you and I may see a 3 to 4. People with EDS have a more sensitive feeling to pain and could respond as to a 6 to 8. So for those type of people, their response to the condition is a little bit stronger than what somebody without EDS would do. So again, this goes back to having you guys have the medical ID training bracelets on the dummies and things like that, because you can set up different situations. I really am doing this because I appreciate you guys. I can't tell you how much I understand what you're going through. I've never done it personally, but I've seen it firsthand. And it takes a real special person to want to do the things that you do and the conditions and everything you have to do to work with. And I want to tell you, thank you. I hope you embrace this. If you have any questions, please let me know. My email address is bfisher20, BFISHER20 @cinci.rr.com. I'll be happy to respond to that. You can contact Alexander or at the Fitzgibbons group. She can forward the emails to me. But if you have any questions, I'm here to help you. Thank you for what you do. And I'll open it up to any questions if anybody has any right now, please. On the screen here, I don't see any questions presently.
Nope, I'm not seeing anything either, Brent.
Okay. Again, I hope I haven't missed anybody in saying thanks. Thank you for your time to watch this. I appreciate all of you. Be safe, happy holidays, and let me know if I can help you again.
Thanks so much for joining us today, and thanks, Brent, for this presentation.
Oh, you're welcome. No problem.
All right, great one.
Are we off?